Hi beautiful people, hello, welcome back to my channel. If you're new here, my name is Shiro. I trained back in Kenya as a nurse and apparently I work in the UK as a registered nurse. So guys, in today's video, I'm going to share the most common questions asked during the interview if you are going to work in the NHS hospitals for a nurse. This doesn't matter whether you're coming from overseas or you're already here in the UK. You might be in the care home and you want to change from care home to NHS like I did. I will also be giving you an overview or some clues of how you are supposed to answer these questions, and so that you won't be, terrified so much while doing your interview. And that way it will prepare you for a good interview session that you're gonna enjoy. Yeah, so in case you're new here, please consider subscribing to my channel. For the returning subscribers, I do appreciate your support and thanks so much for coming back. Also remember to like this video. Share your thoughts in the comment section below, and also in case you have any questions, please do remember to ask in the comment section below. I'll always answer to your questions. And without further ado, let's get into the video. Disclaimer, I'm not an interviewer, I'm just sharing my experiences and the questions that I think they may come during the interview. So don't hold me responsible. Just follow what I'm saying, and also it will guide you, and you can also guide your friends and things like that, because I've done that before. I've been guiding people on how to do these questions, so I'm just sharing this. Yeah, I like doing videos so that they can help as many people as possible out there. Yeah, I'm delighted to bring to you this video because as you prepare to come to do your interviews in the NHS, that is something that I've gone through myself, and also I'll be able maybe to share some of my experiences. Yeah, as I've mentioned, I'll be mentioning a few questions that I did in the NHS interview that I did. And again, do not stress so much, guys, in case you're already here in the UK. Not only that, also if at all you're coming from overseas, probably it might, it might be a little bit the same. What I want to say is, don't stress so much. You need to be relaxed and be well prepared. The other thing is, these questions, they don't ask 10 questions, they don't ask 15 questions. The only thing you need to know is do your diligence, get to revise, some of the common questions that you think they may come, including the questions that I'm going to give you now from my own experience and from the experiences of others. Yeah, so I'll start now, and I'll say, yeah, before I go direct to the questions, I'll start by, if you're coming from overseas, you may expect these questions, so you need to be very, very ready to know how to answer this question. Yeah, so guys, what I did, I noted down these questions and I've put them on my phone, and then I'll start. So if you're coming from overseas, most likely you'll be asked, tell me about yourself. Yeah, or maybe within here, it depends where you're doing your interviews from. So you might be asked, tell me about yourself. So how are you supposed to answer this question? If you are to answer these questions, guys, you have to make sure you keep it very simple and brief. But even if you're keeping it very simple and brief, there are things that you have to touch. So you have to make sure that you include your interests, you include your inspirations, like what made you become a nurse, why did you want to become a nurse, yeah? And also you need to give maybe your experiences at work and also your achievements, which will be relating to the work that you'll be doing. So you have to make sure that you've read your job description before sitting down for your interview. Okay? Yeah. And how do you know? Someone might ask, how do I know my job description? Guys, if you're coming to a medical ward, or if you're going to maybe theater or ICU, go through online NHS, online ICU, medical, what you are required to do and stuff like that. And again, they usually send you the job description before you go for your interview. Yeah, so don't worry about that. You will have gone through your job description and you'll be able to answer what is relevant to your job description. And this question, guys, if you're coming from overseas, it might go down to, why did you choose to work with NHS, or why did you choose to work in the UK? Yeah, so you have to, that's why I said you have to give your inspirations and you have to give your interest. Yeah, so you have to say like, why do you want, I remember my time, not actually NHS, when I came here, I came through care home. So what I did, I said that I love traveling, so there's nothing wrong if you put your interest, and of course now you connect towards where you're going to work and stuff like that. But I'm just going to give this an example. I remember when I was doing my interview and I was asked, why do I want to work in the UK? Yeah, I did mention that I love to travel. Yeah, I would love to travel, and coming to the UK has given me that opportunity, yeah, to travel the world. Again, I did add and mention that UK is a first world country. So being a part of the first world healthcare system, you are part of it, and you'll be able to improve yourself, your experiences or your practice, yeah, in a more advanced level. So you can mention that, but guys, just prepare yourself how to answer that question. You don't have to answer the way I've just said. So the first question is, guys, these questions, most of them, they are scenarios. Yeah, most of them, they are scenarios. And the other thing, most of these questions, they might come down to infection control. So you must know how to prevent or minimize transfer of infection from one place, cross infection. Yeah, so you must be aware of how to prevent cross infection. Number one question on my list here will be needle prick. So you will have a question like, in case you are in the ward and you had a needle prick, how would you manage that? So how do you manage a needle prick? Of course, you're supposed to bleed that needle prick, and you're supposed to wash your hands. You're supposed also to report to your ward manager. You're supposed to also do an incident report. Yeah, I will just keep it simple. Please go ahead and read and see what else you're supposed to do. So it needs to be reported. That is for needle prick. Yeah, and also maybe you'll be tested in case in case you are with a patient and you don't know the status of this patient, like HIV, hepatitis and stuff like that. You might be required to get tested and see if at all you've contracted these diseases or stuff like that. So please just go do your research on that. The other question I would say that you may be asked, it's like an abuse scenario. So you'll be asked, let's say you're in the ward, yeah, and there's a relative there, and they have come to visit their patient, and then you see your colleague is being rude to the relative. This one might go around, or the relative is being rude to the colleague, or the relative is even being rude to the patient. So that's like an abuse scenario. So if you see your staff is abusing a relative or is abusing a patient, what are your actions? What are you supposed to do? This is how you may answer this question. So you have to say, you have to intervene as quickly as possible. You stop your colleague. Yeah, you pull them aside, and also you go talk to the patient and the relative. Get to know what really happened. Okay? Know what happened so that you can know how to handle the situation. Also remember to apologize to the relatives or the patient in case maybe your staff was wrong. Not in case it was wrong. even if you are tempered or something was said to you, as a staff and being a professional, as a nurse, you're not supposed to be rude, neither to your staff, colleagues, neither to the relative or the patient. So you have to know how to handle that situation. Don't forget to report this incident to your ward manager. So you have to hear both sides of the story, yeah, from your colleague and from the side of the relatives, and then from there it will be handled. Okay, but again, go see how you can handle that scenario, what you expected to do. Okay, yeah. And again, if at all it was a relative and patient, remember to separate them, guys. Don't leave them together. You need to separate them. And in this case, by the way, there are situations where they usually go down to the police case. So that's why you should not even keep it to yourself. You need to tell your ward manager, okay? Or your nurse in charge. You need to inform them. The other question would be, what to do in case you noted a drug error. So this question, in a scenario case, it will be like, let's say it's post-op, or maybe it's just in the ward, and you've noted that there's an IV drug that is running, but it's the wrong medication. What are you supposed to do? What should you do in this scenario? So you're supposed to stop this medication immediately, yeah, and inform the nurse in charge, not just a nurse in charge. If you're in the ward, in NHS, the doctors are in the ward. So inform also the doctor. Yeah, inform the doctor so that they will guide you on how to manage the situation. Because if it's IV, remember IV usually goes very, very fast. It's not like tablet, it needs to be absorbed and stuff like that. So you need to know how, you need to inform the doctor, the sister in charge, what happened and stuff like that. But before you do all that, like escalating the matter, also remember you should be taking the vital signs. Take the vital signs of this patient, just in case they are allergic to this medication. You do not know. You can also delegate to one of the staff and ask them, please check the file. You'll be having the allergies noted in this patient's cardex, medication cardex. So you will get to know, are they allergic or are they not? Your first action should be to stop that medication instantly. All right? Yeah. The other question would be how to maintain perioperative area sterile. So this is a theater question, guys. So remember when I said that these questions, most of them, they'll go to infection control. So wherever you are, whether you're in the ward or you're in theater, you're in ICU, your major role is to maintain a free contamination area. So how do you maintain that area clean? Remember, you're not the only person in that ward. No, in theater, I mean. You're not the only person in theater. Yeah? So there are other people there. So they are the running nurse, they are anesthetics, they are the doctors, the nurse in charge, and they are the carers and stuff like that. So you have to know every person in that theater, what is their role. Okay? Because cleaning is not your role. That will be the work of the carer. So what are you supposed to do in this case, or in such a question? You need to know what are the responsibilities of the carer. How do they clean the perioperative area? How do they do it? So you have to mention that the bed has to be cleaned, that is the operating bed. You have to also mention that the lights in theater, they have to be cleaned as well. Also, you have to say there should be a designated area, you know, where you have like the segregation, you know, those bins where you do the segregation. And there has to be the same area. You might have a designated area, donning on and doffing off your PPEs. Yeah, so you have to make sure that all that is you've mentioned in your interview. Again, the other thing you should remember is that, remember, we have stocks and stuff like that. So everything should be in the designated area, even the stock. Yeah, like catheters or maybe the sterile, the equipments and stuff like that. Like everything should be where they are supposed to be. That's the way you're supposed to answer that question. Okay? But make sure you go deeper, know every work of the person who is in theater. Every person, from the doctor, the surgeon, from the carer, and your colleagues, the runner nurse and stuff like that. And that way you'll be able to answer that question. Okay? Yeah, so that was actually one of my questions that I was asked in my interview. Yeah, the other question would be how to manage shock. Okay, how to manage shock. Now, remember you're in a hospital setup, so you're not outside. So this is a person who is already in the hospital. Let's say post-operative care. You need to find out the underlying cause. Why are they going into shock? If this person was in theater, you need to check the bleeding, like the wound, is there bleeding or stuff like that, yeah? Also, you should call the doctors, yeah, and call your colleagues so that they can help you. You need to take vital signs. And the first thing when we come to managing shock, guys, you need to elevate the feet, above the body, like above the neck and the head. That's the way we, even at home, that's the way we would manage a shock situation. So make sure that you elevate the legs of this person. And now go ahead, taking the vital signs and stuff like that, and be ready to resuscitate just in case this person becomes unresponsive. Another thing, as I said, you are going to involve the doctor. That means you'll be doing the IV fluids therapy, yeah? So you will follow what the doctor has told you to do. So those are some of the things that you should notice when you have a person in shock or a patient in shock. How to manage a cardiac arrest. So I've just said when the person is in shock, you may be required to give CPR, yeah, to resuscitate just in case this person becomes unresponsive. So the scenario of this, the scenario of cardiac arrest, you'll be told you are doing your ward round or you are giving medication, you are going to give a certain patient medication, then you found that they are not responsive. What are you supposed to do? Yeah, so what are you supposed to do? You should call every room of the patient. There's a call bell. Yeah, that is call bell. You call for help. So you can just press, then go ahead, check for them, whether they have the pulse. Yeah, you need to check, and you need also to listen for the breathing. You see if they are breathing or they are not and stuff like that. So you should do that assessment. And you're supposed to follow the BLS, basic life support in this situation. So go again, know how to do a resuscitation. Again, in hospitals, I've said you will call for help and stuff like that. So the doctors will come, your colleagues will come and stuff like that in hospital. But go deeper. When you're doing your own research, go deeper and see what you're required to do in case someone is in a cardiac arrest. Or should you get ready? Again, in case there's no one who is there yet, you should start the CPR yourself. Don't wait until people come to help you. No, start the resuscitation by yourself. The other question is, again, this one is to do with infection control. This one is how you make sure that the central line remains sterile. Yeah, so you'll be given a scenario like, let's say you're in ICU, yeah, or maybe post-op. And then you'll be told you have this patient, you're supposed to give medication, but you're supposed to give them via the central line. How are you gonna make sure that the central line remains sterile? Yeah, so number one, it's hand hygiene. But then in everything here, it's hand hygiene. Everything. That's why I said everything is about infection control. Everything you do, you have to make sure that your hands are clean before touching and even after. You will know those moments, the whole 5 moments of hand hygiene. You're supposed to know that. So make sure that your hands are clean. Make sure that you've donned your gloves and your apron, like what you're supposed, the sterility, you're supposed to maintain that sterility. Don't contaminate the central line. Also, the way you prepare medication also matters. So you have to make sure that the way you're preparing the medication to give through the central line is in a sterile way, because you don't want to introduce microorganisms to this person's central line. You don't want to introduce microorganisms, yeah? Yeah, so that one is infection control again. And also make sure you talk to your colleagues, maybe the carer or the nurses, whoever who is handling this patient. You have to make sure, or maybe let's say even those people, maybe they are feeding, their bedridden and they are feeding and stuff like that. Also make sure you talk to these people who are feeding them. Most likely in ICU, the nurse will be doing the feeding, but make sure whoever who is connected to this patient with a central line, they know the infection control measures. All right? Yeah. The other question that you might expect in NHS interviews will be donning and doffing the PPEs. I think that one I've already mentioned. Yeah, you need to know. So hand hygiene first. You need to know how to don your PPEs. What are the PPEs? The gloves, goggles, you have the aprons, you have the head caps. Yeah, you have all that. You may even be having the boots and stuff like that. So you need to know which one to start and which one to finish with. Again, when you are removing them, also you need to know which one to start removing and which one to finish removing. So you have to, and you know, there's somewhere you're told after you remove this, you know, because of COVID, guys, so infection control is very keen, and they want to know whether you know how to don these PPEs well, or whether do you know how to don, no, do you know how to doff, like doffing, removing them. Yeah, and again, you should do this in a designated area. So you have to explain that, your process of donning the PPEs and your process of removing the PPEs, which is doffing. Okay, the other question would be management of diarrhea. Yeah, so the scenario would be, let's say you're in a medical ward. Yeah, probably you're in a medical ward, and then you come to this patient, maybe it's in the morning. You've just received a report from last night that this person maybe has had diarrhea continuously throughout the night or stuff like that, you know. Yeah, it's just a scenario. So what are you going to do as the nurse who is taking over? Yeah, so how do we manage diarrhea? Guys, remember, infection control is number one. Yeah, so make sure that the patient's clothes, they're not mixed with other people. Yeah, make sure that you encourage oral fluids if at all this person is able to take oral fluids. I used to use ORS. Yeah, it was oral rehydration solution. In case they are not able to like drink, let's say maybe they're even like throwing up. Yeah, if they're throwing up, maybe they are not gonna retain anything that they get orally. So what are you supposed to do? So you talk to the doctor, of course, and then you will start IV fluid therapy. So yeah, as a nurse, you should know that a stool sample is required in this situation. Yeah. Okay, let's continue. The other question will be how to manage hypoglycemia. So the kind of a scenario question that will be given, you're going to give medication, or you're doing your medication round, then you find someone is hypoglycemic. What are you supposed to do? So in this scenario, guys, there are these gels, you know, the glucose gel. So you can start with that one. Yeah, you can start with that one, but even before you start with that one, guys, you're supposed to take the sugar. So get the glucometer and check the sugar levels. Check the sugar levels, and of course you see the symptoms. Of course, that's the way you know that this person is hypoglycemic, because you already know the signs of hypoglycemia, you know, like cold, clammy feet, you know, sweating and stuff like that. You will know that. And again, these people, they might not be responsive as well. Yeah, they might not be responsive. So also be ready to resuscitate just in case. But you can get the Rapilose gel, which is the glucose gel, and also you can give like ice cream. You can also give like juice or food with sugars and stuff like that. But of course, you will start with that thing that has the sugar and will be absorbed quickly, like the glucose gel. And again, monitor the sugars. Yeah, you keep monitoring the sugars, and you keep giving what you are giving, either the gel or the fluids like juice. Yeah, something with sugar, that's what you need. You can give the chocolates, you can give sweets or things like that. Also, maybe if this person is not able maybe to take these things orally, you can do you can most likely, as I said, there's a doctor in the ward, so this doctor will be able to prescribe the IV fluids, you know, it's like dextrose, yeah, 50%, but anyway, you follow what has been prescribed by the doctor. So the other question that I didn't write here, but I remembered is there's this scenario where I was given, like there's this patient who came from the ward and they came to theater only to realize that the leg that was marked was the wrong leg. It's not the one that was supposed to be. It's not the one that was supposed to be operated on. How would you handle as a nurse? You're the one who's receiving, you know, you're the one who's receiving the patient in theater. So how would you handle when you see that this patient, the leg that is marked is the wrong leg? What can you do? I remember in such a scenario, you need to confirm that you have the correct patient. That is number one. So that maybe it's not that you have another patient with a different maybe condition and stuff like that, so they were marked for the wrong procedure or something of sort, yeah? So you have to make sure that you use that checklist to confirm that the notes that you have for this patient is the correct patient. Also, you should like apologize to this patient. You need to tell them exactly what's happening. There's something that is wrong. You need to apologize because you need to tell them exactly what is going on. Yeah, apologize because of the delay. You can imagine being told that something is wrong and stuff like that. You might be nervous. Yeah, the anxiety. So if you're anxious, you need someone to allay your anxiety. So that's why it's good to update this patient what's happening. Yeah, so you need to follow up with the ward, and again you need to inform the surgeon to come and confirm. Yeah, because most likely the surgeon is the one who marked the leg. They need to confirm that this is the correct patient and the procedure that's supposed to be done is the correct procedure, but we need to know why is it marked on the wrong leg or part of the body. Again, you need to follow up with the people in the ward, the nurse was handing over what really happened, you know, because they're the ones who did the checklist and you are just going through the checklist. So you need to do that as well. So those are the kind of scenarios that you may be given. Guys, there's something I haven't mentioned, and this is a bonus. Never stop. Never stop answering these questions. That's why I've just given you just an overview of the kind of questions that you might be asked during the NHS nurses interview. Yeah, so make sure you go deeper in these conditions or any other condition that you feel maybe might come up, yeah, like CCF, CVA and stuff like that. Just go through those conditions that you think might be asked. Again, go deep. Give every detail that you know about this condition, everything. You are selling yourself because you'll be asked just 3 questions. They don't ask more than 3 questions, okay? But in case you get to be asked more than 3 questions, guys, please I said this is a disclaimer, I'm just sharing, yeah? But in my case and the case of other people that I know, they answer 3 questions out of many conditions that we know. So just make sure that you study for this, you know, not really studying, like do your research, do your research and make sure that you're having the correct information regarding these conditions here. Yeah, so that's why if you are to make sure you explain every detail, like the skin prick, explain everything, drug control, drug error, everything. How are you supposed to manage from top to bottom? Because I've just given the overview and even overview of the answer. So go deeper. Don't just give the highlight that I've just given. Yeah. So I'm happy to have shared these questions that I think they are the commonly asked questions during an interview in NHS for a nurse. Okay. So what can I say? Thank you so much for watching this video, and I really appreciate your support. In case you've not subscribed, guys, remember to subscribe to my channel, okay? And I'll be seeing you in my next video.